Kidney disease is a serious medical condition that can affect millions of people around the world. The kidneys play a crucial role in maintaining the body's balance by filtering out waste, excess fluids, and toxins from the blood. They also help regulate blood pressure, maintain electrolyte balance, and produce hormones that are essential for various bodily functions. When the kidneys begin to fail, their ability to perform these tasks diminishes, leading to a buildup of harmful substances in the body. Kidney disease can develop gradually, often without noticeable symptoms in the early stages. However, recognizing the early warning signs can make a significant difference in preventing further kidney damage and improving the chances of successful treatment. While the most severe symptoms of kidney disease are often apparent in advanced stages, it's important to be aware of the more subtle signs that could indicate the early stages of kidney dysfunction. Early detection and intervention are crucial in slowing down the progression of the disease and improving overall health outcomes. Below, we discuss the most common signs of kidney disease, as well as what they mean for your health. Fatigue and weakness. One of the earliest and most common signs of kidney disease is unexplained fatigue and weakness. The kidneys produce a hormone called erythropoietin, which helps stimulate the production of red blood cells. Red blood cells carry oxygen from the lungs to various parts of the body. When kidney function declines, less erythropoietin is produced, leading to a decrease in red blood cell production. As a result, the body experiences a lack of oxygen, which leads to feelings of exhaustion, weakness, and a general lack of energy. Fatigue associated with kidney disease can occur even if you're getting a full night's rest. People with kidney dysfunction often find it challenging to perform normal daily activities, such as walking, climbing stairs, or even going to work. In severe cases, this tiredness can make it difficult to get out of bed. If you are experiencing persistent fatigue despite sufficient sleep, it may be time to consult a healthcare provider to determine if kidney disease could be the underlying cause.
A symptom of kidney failure can be fatigue or being excessively tired even when you've had good sleep. There are many reasons that you could be fatigued. Anemia is one of them, or a low blood count. And you can also be fatigued if you have a shortness of breath, especially if you have fluid overload in your lungs related to kidney failure. So the number one symptom of kidney failure, fatigue.
Swelling, edema. Swelling, or edema, is another common sign of kidney disease. When the kidneys become damaged and are unable to filter waste and excess fluids effectively, fluid can build up in various parts of the body, causing swelling. This swelling is typically most noticeable in the feet, ankles, legs, and face, although it can also occur in the hands or abdomen. One of the reasons for this fluid retention is the kidney's inability to filter out excess sodium, which leads to the body retaining more water. This results in swelling, particularly in the lower extremities. In some cases, fluid may accumulate around the eyes, causing puffiness or a bloated appearance. If you notice swelling in your legs or face, especially if it doesn't improve with elevation or rest, it's important to seek medical advice, as it could indicate a problem with kidney function.
Now, if you have swelling in your ankles and feet with kidney disease, you probably have stage 3 or greater, and generally you see that symptom, that issue more when you're in the later stages. And a couple things that you can do to help. So if you do have that, you're looking to improve it. I remember when I was in the later stages of kidney disease, I had a lot of swelling, but I didn't know what I know now, so that I was able to help myself back then. So one of the first things that you want to do is reduce the sodium, get all the salt out of your diet as much as possible. You want to reduce that salt to 1,500 milligrams per day, up to 2,200 milligrams per day is considered the recommendations for kidney disease, but I would try to even keep it lower into that 1,500 milligrams or less per day to reduce that swelling. Now, the second thing, which is a big issue, is when, depending on the type of kidney disease in the later stages, you might have a lot of protein loss in your urine. So you're losing a lot of protein, and in turn, this causes your protein levels in your body, specifically your albumin, to drop. And albumin is something on the blood work. And so when these levels drop, you don't have adequate protein in your body, which regulates the fluid balance. So this is a big issue in kidney disease. And to correct this, you can eat more protein. The problem with that is eating more protein causes more toxins, more stress on your kidney. But that is one approach that some people use, and depending on what your diet is, that's something you can try. But a better option is using essential amino acids or keto analogs of essential amino acids. And that's not to be confused with a keto diet or any of that you might read on the internet. What these are is precursors to protein, or essential amino acids are the building blocks of protein. So by taking those amino acids or keto analogs of amino acids, which are essential amino acids and precursors, you're going to get all the protein you need without actually eating protein, so you can correct those albumin in those protein levels, thereby reducing the swelling.
Changes in urination. Changes in urination are often some of the earliest signs of kidney disease. People with kidney problems may notice that they are urinating more frequently, particularly at night, a condition known as nocturia. Alternatively, some people may experience a decrease in the amount of urine they produce, or they may have difficulty urinating altogether. In addition to these changes, the urine may appear foamy or bubbly, which can be a sign that protein is leaking into the urine. Proteinuria, protein in the urine, is a common symptom of kidney disease, as the kidney's filtering capacity becomes compromised, allowing proteins like albumin to pass into the urine. Furthermore, the color of the urine may change. Healthy urine is typically pale yellow, but if the kidneys are not functioning properly, urine may become dark, red, or even tea-colored, indicating the presence of blood. Blood in the urine, known as hematuria, can be a sign of kidney stones, infection, or more serious kidney disease. If you notice any changes in your urination patterns or the appearance of your urine, it's important to consult a doctor for further investigation. Persistent itching, pruritus. Itching, or pruritus, is another symptom that may develop as kidney disease progresses. As kidney function declines, waste products that would normally be filtered out by the kidneys begin to build up in the bloodstream. This condition, known as uremia, can cause toxins to accumulate in the body, leading to persistent itching. The itching can occur all over the body, even in the absence of a rash, and may worsen at night. The cause of pruritus in kidney disease is not entirely understood, but it is thought to be related to the accumulation of waste products, as well as imbalances in calcium, phosphate, and other minerals. In some cases, the itching may become severe enough to interfere with daily activities and sleep. If you experience chronic itching without an obvious cause, it's important to discuss it with your doctor, as it could indicate kidney dysfunction. Nausea and vomiting. As kidney disease progresses, the buildup of toxins in the bloodstream can lead to gastrointestinal symptoms, including nausea and vomiting. These symptoms often occur when kidney function has declined significantly, and the kidneys can no longer filter out waste effectively. The body's inability to eliminate toxins can result in a loss of appetite, nausea, and a feeling of general malaise. People with kidney disease may also experience weight loss due to reduced appetite and difficulty keeping food down. If nausea and vomiting persist despite efforts to manage them, or if they occur alongside other symptoms like swelling and fatigue, kidney disease may be the underlying cause. Consulting a doctor for further evaluation can help determine whether kidney dysfunction is contributing to these symptoms. Shortness of breath. Shortness of breath is another symptom associated with kidney disease, particularly in the later stages. This occurs because when the kidneys are unable to filter waste effectively, excess fluid can build up in the lungs, leading to pulmonary edema. This fluid buildup makes it difficult to breathe, especially when lying down. In some cases, shortness of breath may also be related to high blood pressure or heart problems, both of which are common complications of kidney disease. The kidneys help regulate blood pressure by controlling the balance of fluid and sodium in the body. When kidney function declines, the body may retain more sodium, which raises blood pressure and puts extra strain on the heart, leading to fluid buildup in the lungs. If you experience shortness of breath, particularly with physical activity or while lying down, it's essential to seek medical advice promptly. High blood pressure, hypertension. High blood pressure is both a risk factor and a symptom of kidney disease. The kidneys help regulate blood pressure by maintaining the balance of fluids and electrolytes in the body. When kidney function declines, the kidneys become less efficient at controlling blood pressure, which can lead to hypertension. In fact, high blood pressure is one of the leading causes of kidney disease, and kidney disease can, in turn, cause high blood pressure. If you already have high blood pressure, it's important to monitor your kidney function regularly to ensure that the condition is being managed effectively. On the other hand, if you develop high blood pressure unexpectedly, or if your blood pressure becomes difficult to control, kidney disease may be contributing to the problem. High blood pressure can exacerbate kidney damage, so it's important to address it promptly to prevent further kidney dysfunction.
The kidneys and the heart are like a married couple, okay? If one's not happy, the other one probably isn't happy as well, okay? And I've always taken that to heart, no pun intended, to think about how medications that we take and how we address cardiovascular risk factors can also have an impact on any type of kidney disease or the health of the overall cardiovascular system. It's important to realize that in multiple disease states, the kidneys and heart have a bidirectional relationship. And what do I mean by that? Well, let's just take the example of hypertension, okay? Hypertension can ultimately lead to kidney disease, which can ultimately lead to worsening hypertension, okay? Hypertension ultimately leads to thickening of the heart muscle, and if it's called left ventricular hypertrophy, and then can, in certain circumstances, lead to heart failure, amongst other cardiovascular complications, including atrial fibrillation, coronary artery disease, aortic dissections, etc. So thinking about them together is going to be really important long term. It's also important to realize that patients with kidney disease don't die of quote-unquote kidney disease, okay? We have technologies that can extend life, dialysis, kidney transplants, etc. Why do they die? They die of cardiovascular disease, the vast majority, particularly as kidney function declines. There's really good data showing that as the level of kidney function declines, the most common measurement for that is the estimated glomerular filtration rate, or the GFR. So as it declines, even below 75, we see at each stepwise progression a higher incidence of cardiovascular disease. The same can be said for kidney disease, which is actually noted via the presence of protein in the urine. The more protein or albuminuria that you have in the urine, or that's detected, the worse people tend to do from a cardiovascular disease perspective. Now, the good thing is that there's medications that can be used that are helpful for the heart and helpful for the kidneys in terms of reducing proteinuria, etc. And so keeping that in mind is going to be really important. There's certain medication classes that we tend to prefer in patients with chronic kidney disease to ultimately preserve renal function. So that's certain classes of blood pressure medicines above others. So it's really important to talk with your doctor, be it your primary care doctor, be it your cardiologist, perhaps it's your nephrologist as well, to think about what the right combination of medications is for you.
Bad breath, uremic fever. Bad breath, also known as uremic fever, is a distinctive symptom of kidney disease. When the kidneys can no longer filter out waste properly, toxins like urea build up in the blood. These waste products are then exhaled through the lungs, resulting in a foul, ammonia-like odor in the breath. This distinctive odor, often described as metallic or urine-like, is a telltale sign of kidney failure. Uremic fever can be particularly noticeable and unpleasant, especially when kidney disease is advanced. If you notice a persistent foul odor in your breath, especially if it is accompanied by other symptoms of kidney disease, it's important to see a healthcare provider for evaluation and treatment. Kidney disease is a progressive condition that can have serious consequences if left untreated. Recognizing the early signs of kidney dysfunction, such as fatigue, swelling, changes in urination, itching, nausea, and shortness of breath, can help prevent further damage and improve outcomes. If you notice any of these symptoms, it's important to seek medical attention as soon as possible to address the underlying cause. Early detection and intervention can help slow the progression of kidney disease and improve overall health and quality of life. If you found this video helpful, don't forget to like, subscribe, and share it with your loved ones. Take care. See you in the next video.